Hello friend, welcome to my channel 5 Minute Pediatric. Few days back I have asked question related to this picture. So let's break down all the clinical clues given in this question. So the first clue is the child is having silver hair. So we have partial oculocutaneous albinism. So the exact diagnosis is Chediak-Higashi Syndrome. So pathophysiology for this silvery hair is, so in Chediak-Higashi Syndrome there is mutation of LYST gene. Okay, this leads to impairing lysosomal trafficking, and melanocyte cannot distribute melanin. This lead to silvery hair appearance or skin becomes pale. Next hint, we have recurrent pneumonia. So similar to melanocyte, giant cells, neutrophils have giant dysfunctional lysosomal granules. So this leads to impairment in chemotaxis. So the microbes are not killed effectively. So this leads to severe pyogenic infection, especially by staph or streptococcus. Next clinical clue, the child is having neurological delay. So this abnormal trafficking also affect neurons. This leads to peripheral neuropathy, cognitive decline, ataxia, hypotonia. So Chediak-Higashi syndrome is a multi-system disease and it involves skin, immune and brain. Next clue, we have peripheral smear. So in peripheral smear you get the giant granules in neutrophil. So this is pathognomic of Chediak-Higashi syndrome. In blood smear you get giant azurophilic granules inside neutrophil, eosinophil and monocyte. Why it occurs so there is a defective fusion of primary granules with phagosomes. Now there is immune dysregulation in the question. What we call the hemocytic phase is there. So this is the most dangerous stage, and this is often triggered by viral infection like Epstein-Barr virus, where immune cells go rogue and hyperactivated macrophage start eating up RBC, WBC and platelets. So what we call it hemophagocytic lymphohistiocytosis. Commonly we call it HLH. So in lab finding, what you get high ferritin, cytopenias, high triglycerides and low fibrinogen. So this is a very fatal condition, so you have to treat it urgently. So based on all these clinical clues, so the final diagnosis is Chediak-Higashi syndrome. So gene, we have to remember LYST gene, lysosomal trafficking regulator. The mode of inheritance is autosomal recessive. Management includes, we have to control the infection by giving prophylactic antibiotic, IVIG. For HLH treatment, we require etoposide, dexamethasone, but the definitive treatment is hematopoietic stem cell transplantation. So you commonly get the question related to Chediak-Higashi syndrome in various examinations. So you have to know the basics, you have to know the pathophysiology, and you have to know the pathognomic feature of Chediak-Higashi syndrome. So this is all about today's explanation. Hope so enjoyed this video. If you like this content useful, kindly share amongst your colleagues, your friends. Thanks for watching.